Health Check with Nurse Jenn is presented by Island Cancer Center.
Hello and Hoffaday, I'm Nurse Jenn. It's time for your health check. Tonight, let's examine a concept occurring in mental health known as dual diagnosis. Clinical research studies have shown an alarming rate of dual diagnosis with clients experiencing both psychiatric and substance abuse disorders at the same time. The high rate of dual diagnosis suggests the need for greater integration of mental health and substance abuse treatment plans. The professional fields of mental health and substance use recovery have different cultures, so finding integrated care can be challenging here on Guam. According to the National Survey on Drug Use and Mental Health, approximately 7.9 million people experience dual diagnosis, with an alarming incidence to the male gender. Because many combinations of dual diagnosis can occur, the symptoms vary widely. Mental health clinics are starting to use drug and alcohol screening tools to help them identify people at risk versus actual addiction. Symptoms of substance abuse disorder can start with withdrawal from family and friends, sudden changes in behavior, engaging in risky acts, loss of control over use of substances, developing a high tolerance, and exhibiting withdrawal symptoms and urgent need to use drugs or alcohol to function for simple day-to-day activities. And then there's mental health symptoms that can be similar to drug and alcohol abuse. Warning signs of a mental health disorder can begin with extreme mood changes, confused thinking, difficulty concentrating, lack of ability to focus, avoiding family, friends, or even social activities, and thoughts of suicide or harming other people. This is a problem. When a person exhibits both mental health and substance abuse symptoms at the same time, it's best to treat the individual for a dual diagnosis with integrated and combined therapies. Integrated intervention means the person will receive care for both their mental health diagnosis and substance abuse addiction simultaneously. The idea that an individual cannot be treated for depression until they correct their drug or alcohol addiction is very outdated. Current medical research supports treating both issues at the same time while understanding that each condition affects the other. It's obvious that treatment planning cannot be the same for everyone and must be specifically created for each person diagnosed dependent on their level of addiction and psychiatric diagnosis. Combination treatment therapies can include detoxification, 12-step AA meetings, inpatient rehab, outpatient rehab, supportive housing, psychotherapy, self-help meetings, support groups, and prescribed medications. The individualized treatment plans help people with dual diagnosis learn how to cope with and change ineffective patterns of thinking and behaviors. I'm Jen Artero, registered nurse, reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.